All right, this is Dr. Tshamala over in Palmercare in Sterling. I'm here with Raul, who's having some difficulty, some pain, discomfort in his wrist. I'm just going to have him explain exactly what's going on. I'm going to basically take a look at it. We'll do some muscle work, and I'll adjust at the end.
So basically what's going on is just like all of you or most of you nowadays are working from home. I'm also spending a lot more time on the computer, on the laptop, and my setup for being at home is not necessarily the best compared to my work environment one. So I tend to kind of overcompensate, lean forward, and it really puts a lot of flexion on my wrist, which tightens them both up. It makes it difficult for one to move the mouse, two to type anything, and for any like longer duration than five to 10 minutes, I just feel this pain going on.
So before I get started, I'm going to switch spots with Raul. Raul, you're going to come kneel down over here. I'm going to just bring the stool right over here. Make yourself comfortable. You want to go?
Huh?
Yeah,
I'm good.
Okay. All right, let's see. We'll work on this one here. Again, all I'm doing here is just kind of poking around, trying to identify some trigger points that might be present in the area. Let me know if there's any pain, anything uncomfortable here.
Yep, right there.
Right there?
Yep.
Okay. Is it just localized right there, or is it shooting down into the wrist?
Right there.
Just right there. Okay, so I'm just going to work on that knot, that trigger point a little bit. Again, sometimes these knots can become apparent with overuse of the muscle, and we basically get to a point where lactic acid accumulates within the muscle belly. So all I'm doing here again is just trying to flush that lactic acid back into the circulation, or allow the muscle to just kind of loosen up and relax a little. And if I'm doing too much, let me know. Okay?
Mm-hmm.
All right. Good. Perfect. Just a couple more passes here. And this is just kind of like a pin and stretch technique that I'm using here. I'm just trying to focus exactly where the discomfort is. And all I'm doing is applying a little bit of pressure. And then at the wrist here, I'm just kind of creating a little bit of flexion. It's not very pleasant, as you guys can see from our old face, but it does a really good job at just taking care of that lactic acid, that trigger point in the area. So usually I'll do a few passes of that. Good. I'll do one more, right? Take a big breath in and let it go. Excellent. Good. And then for the adjustment, what I'm going to first do is just kind of mobilize the wrist and then identify the areas that are stuck, restricted, and not moving properly. And that's exactly where I'm going to focus. Any of that causing any pain, any discomfort? Okay. So some of the carpal bones are actually moving really well, and then there's other areas that are a little bit more stuck, more restricted. And that's exactly where I'm going to introduce motion. Right there. All right. Nice and easy. Lean back a little bit and a little bit. Excellent. Good. Excellent. Good. That's moving perfectly. And then the last one I'm going to do is right over here at the scaphoid. I'm just going to kind of hook it. I'm going to reinforce with the other hand, and all I'm going to do is just kind of traction and pull towards me. So we just have to loosen up. So as we feel that movement.
Yeah.
Okay. There we go. Perfect. Oof. Excellent. And there we go.